Hello and Minglaba, welcome to MI Radio's Myanmar Today. I'm Henry Zin. Amid the coronavirus pandemic, strategic recovery plan for Myanmar tourism sector is already underway. China Naval Medical University donates medical equipment to Damador. Economy shaken by the pandemic and ongoing COVID-19 crisis almost makes domestic gold market to halt the gold trade. And a story coverage on fish paste and dried fish prices likely to drop post-Thingyan. All of that coming up later, but for now let's take a look at what's happening in local news. Damador has offered to use its two Cobas 6800 machines for COVID-19 laboratory tests, according to the Facebook page of Director General Usorte from the Ministry of State Councillor Office. One of the machines at the No. 2 Defence Services General Hospital will be used for testing local representatives of defence services and those who are at the community-based facility quarantines in Naypyidaw Council area, Naypyidaw Council, and nearby regions and states. Another analyzer at No. 1 Defence Services General Hospital in Yangon will be used for testing the returnees who are at the community-based facility quarantines in Cayenne and Mun states after coming back from Thailand. According to the report of the Office of the Commander-in-Chief of Defence Services, on 24th of April, the Cobas 6800 machines are in full automatic system and have the lowest risk of infections to the users, although the results are the most accurate. Laboratory tests of the National Health Laboratory in Yangon on the 95 samples and 119 samples by the Department of Medical Research, totaling 214 on Monday afternoon, have shown 5 more new cases, and 1 other new case was tested at No. 2 Defence Services Hospital in Naypyidaw, amounting to 6 new cases. There are a total of 161 confirmed cases in Myanmar up to 8 p.m. on Monday. 6 positive patients have died until now. There are a total of 61 new persons under investigation in the past 24 hours from Monday noon. Local representatives, Musa district or township officials, business persons and donors convened at the Musa District Hall on Monday to discuss ongoing and future processes on prevention of COVID-19 in Musa, Northern Chan State. Musa District Administrator Ulain Sotan discussed preparations for COVID-19 in Musa, sending people who have completed 21 days quarantine to relevant departments, transporting people arriving from China and other regions of Myanmar in facility quarantines, and the purpose of the meeting. Union Minister for Social Welfare Relief and Resettlement Dr. Wimya A discussed the latest situations of internally displaced persons in Balawat Township, Chin State, cooperation between the ministry and Chin State government, and continued assistance. The Union Minister said the conflicts in Balawat have forced the IDPs to flee not only to Balawat but also to Yangon City and Rakhine State as well. He said there are currently short and long-term processes for the IDPs and COVID-19 needs to be incorporated as an important topic. Dr. Wimya A said they are implementing action plans for the 5 states that have IDP camps, and national-level meetings are discussing additional food deliveries to IDPs in Balawat. He said they regularly share COVID-19 news and information in the IDP camps and supply them woven face masks, soap, body thermometers, and wash basins as necessary. 276 Myanmar citizens returning from China through Lokai Township, Gokan Self-Administered Zone were reportedly sent back to Lashio and Mandalay on Sunday. The returnees include 66 people from Bagur region, 100 from Magwe region, 31 from Mandalay region, 2 from Naypyidaw Tekong, 58 from Ayawri region, 15 from Sagaing region, 2 from Rakhine State, and 1 each from Yangon region and Cayenne State. The returnees were urged by the township administrator and concerned officials to abide by preventive measures and provided them with necessary assistance. That's all with the local news. Let's take a look at the first report now. The non-governmental task force consists of the stakeholder associations in the tourism industry to implement the strategic recovery plan for Myanmar tourism sector. The action plan is going to implement 3 targets: the immediate short-term plan, mid-term plan, and long-term plan. The immediate plan is likely to start in the next 3 months. Pyo Tiritu and Pieteng report.
A strategic recovery plan for Myanmar tourism industry in the post-period of COVID-19 has been underway and tasks will be carried out during this month. The plan will focus on marketing, tourism sector development, and safety as well. Myanmar Tourism Federation is organizing the strategic plan in cooperation with its brotherhood associations, including the Union of Myanmar Travel Association, Myanmar Tourism Marketing, Myanmar Hoteliers Association, and Myanmar Restaurant Entrepreneurs Association. UK Aunto, Vice President of Myanmar Tourism Federation, said,
tourism industry က March မှာရပ်သွားတာပေါ့နော်ဆက်သွား April မှာတော့လုံးဝကိုရပ်ထပ်သွားပြီးတော့အခု May လကိုရောက်လာတာပေါ့နော်ရောက်လာတော့ကျွန်တော်တို့ကတော့အခုလောလောဆယ်ကျွန်တော်တို့
The tourism sector had to suffer a remarkable downturn in March, ended in April, and now May is going. A task force comprising experts and stakeholders in Myanmar tourism industry has organized to seek the solution to the crisis, especially considering the current midterm and long-term situations. There may be a reduction in workforce currently to be able to continue in the long run. We must continue working with the rest of the people. Once the sector returns to normal, it will create many job opportunities again. We are working on action plans in the implementation of the strategy. We are also taking the inputs from respective businesses. The Ministry of Hotels and Tourism has been informed of this strategic recovery plan, and it will be submitted and requested once it is completed.
The task force is comprised of the stakeholder associations in tourism industry to implement the strategy recovery plan for Myanmar tourism sector. The action plan is going to implement 3 targets: the immediate short-term plan, mid-term plan, and long-term plan. The immediate plan is likely to start in next 3 months, May, June, and July. U Nau Nau Han, President of Union of Myanmar Travel Association, said,
ဒီ6လနဲ့တစ်နှစ်အတွင်းမှာလည်းကာလအလတ်ပေါ့နော်အလတ်ဟာလည်းပါလာသလိုဒီတစ်နှစ်ကနေ3နှစ်အတွင်းပေါ့နော်နှစ်ရှည် recovery ရေတိုနဲ့ရေလက်နဲ့ရေရှည်နဲ့အဲ့ဒီ3ကာလ3ခုလုံးအတွက်ကိုကျွန်တော်တို့က timeline တွေဆွဲပြီးတော့လုပ်သွားမယ်ဟာဖြစ်ပါတယ်ခင်ဗျ
The midterm plan is going to activate within 6 months beyond COVID-19 outbreak control. The long-term plan will take from 3 to 5 years. Approximately, it will take about 6 months to operate the tourism industry even if the virus outbreak is kept under control. Only about 10 to 20% of the industry can be generated within 6 months. We will have to take 1 to 2 years for ensuring that Myanmar tourism industry to resume half of its operations. Even if the outbreak is only months away, the tourism sector will take a few years to bring back a normal situation. Even if the pandemic can be controlled globally, the financial crisis is going to follow. The employment opportunities are scarce and unemployment rate is getting to rise. While people are getting over the crisis, they can be able to spend money on travel. The crisis will be the biggest negative effect on tourism sector. So we have estimated and made preparations, hoping a full and normal operation is going to be in 2023.
According to the United Nations World Tourism Organization, international tourist arrivals worldwide grew 4% in 2019 to 1.5 billion. And Myanmar is ranked as the fastest growing travel destination while experiencing a 40.2% increase in visitors. Though the world tourism market is decreasing because of the global pandemic, the experts said that the tourism market is going to turn up when the world defeats the outbreak.
That's a report on the strategic recovery plan for Myanmar tourism sector that's already underway. After 2 weeks of collaboration between China People's Liberation Army and Tamador, Naval Medical University of People's Republic of China donated medical supplies to Defense Services General Hospital in Mingladon Township on Monday, and the event was attended by the Chinese ambassador to Myanmar, Mr. Chen Hai, and Brigadier General Wu Minzo, the commanding officer of Defense Service General Hospital. Williamson has more.
The medics from People's Republic of China who arrived in Myanmar on 24th of April has been in Myanmar for about 2 weeks. in the fight against COVID-19 in collaboration with different institutions in Myanmar, mostly with the government. Therefore, as the outcome of this collaboration between China and Myanmar, Naval Medical University of People's Republic of China donated medical equipment and accessories to PCR Laboratory of Defense Services General Hospital 1 in Mingladong Township in Yangon region. And the ceremony to hand over the medical supplies was held on 4th of May, attended by Mr. Cheng Hai, the Chinese ambassador to Myanmar, and Brigadier General Min Zhou, the commanding officer of hospital, and other high-ranking officers from both Chinese embassy and from Doctorate of Medical Services of Myanmar Tamro. Speaking at the event, Mr. Chen Hai, the Chinese ambassador to Myanmar, said, as Myanmar and China have a long diplomatic relation, the two ministries of defense services are also working closely together for a long time. When the outbreak of COVID-19 was high in China, both the government of Myanmar and Tamro were there to help the government of China. Therefore, for all those helping hands offered to us will not be forgotten. We are doing all that we can under the guidance of President Xi Jinping to assist the world in fighting against COVID-19. Speaking to the media, Mr. Cheng Hai said,
两军的专家们交流得很好，对于中方专家组在这儿开展的工。
The relation between the two defense ministries from both China and Myanmar is one of the most important elements in diplomatic relations between China and Myanmar. In the fight against COVID-19 in Myanmar, helping Tamaro in fight is also very important. Therefore, soon after we received medics team from China, we also received the experts from defense services in China. The main aim is working together in this crisis. We are learning from each other while working together. We share the experience. Many of the equipment and accessories brought by the naval team are mostly needed by Tamaro in Myanmar, especially the laboratory which the naval team has donated to Tamaro will play a crucial role in fighting against COVID-19 in Myanmar. With the collaborative work of all the related departments, I believe we have seen better results in many areas, and I feel proud to all good results as an ambassador.
The medical team from the Naval University from China People's Liberation Army has been closely working in Myanmar, especially together with Tamro, in preventing the spread of COVID-19, holding several meetings with several departments, exchanging experience and knowledge. And according to Professor Bai Chong, chest physician representing the team, also said one of the key equipment, which is laboratory, has been fixed well enough to perform necessary operation at Defense Services General Hospital. Speaking to the media, Brigadier General Min Zhou, the commanding officer at Defense Services General Hospital 1, said,
Collaborating with China has been very much beneficial to us, especially in the field of practical areas, as we only used to have knowledge on COVID-19, but the coming of medics from China helped us understand about COVID-19 in a practical way. We came to understand how it spread and infect the people, how we can prevent it, diagnosis and treatment as well. Although we don't have yet a solid vaccine for the virus, we were given valuable advice to repair the laboratory and donated several necessary equipment based on what they have experienced in Wuhan. The team from China is also helping us in producing a handbook providing the guidance on preventing COVID-19. As China has set example in eliminating the virus in Wuhan, I promise that we will also work till we have achieved the goal. I also pray that China will be able to help other nations more with the resources that they have in technology, human resources, and the abilities.
This is Williamson for MI Radio.
Stay with us. We're going to bring you more reports on Myanmar Today. COVID-19 pandemic has recently hit Myanmar in addition to the rapid spread of its infection to the whole world. As part of precautionary measures against the COVID-19, the government authorities have enforced stay-home orders, suggesting that the people should stay at home as long as and as much as they can. Such a situation has resulted in a slow trade in the gold market, as most people don't buy any goods except for the essential ones. Suleiman has more on the story.
The pandemic disease of COVID-19 is currently touching Myanmar in addition to the rapid spread of its infection to the whole world. As part of precautionary measures against the COVID-19, the government authorities have enforced an order of stay home, suggesting that the people should stay at home as long as they can. Such situation has resulted in a slow trade in gold market, as most of the people don't buy any goods except for the essential ones. It was learned that some businessmen bought a smaller amount of gold instead of holding only cash in hand over the past few days, but later didn't buy it anymore. Yangon Region Gold Entrepreneurs Association, carrying out daily buying and selling activities, temporarily stopped the gold trade in the domestic market to curb the spread of the coronavirus. No report has been known to reopen the gold market so far. U Zhongwen, chairman of Myanmar Gold Entrepreneurs Association, said,
Ongoing COVID-19 affects all businesses to some degree. Our gold market is also affected. Other businesses are also the same matter. People buy gold only if other businesses go well. That is why gold depends on other businesses. If other businesses don't go well, the demand for gold will decline. Most of gold and jewelry shop owners have temporarily stopped their gold business since before Thingyan. The buyers seldom came to buy the gold at that time.
The global gold price formerly stood at more than $1,700, but at the end of March it down to $1,500, and domestic gold price decreased by 60,000 jas. The change in gold price brought about a big loss to large-scale gold traders, and the gold shop owners saw a slow gold trade. The gold entrepreneurs and gold shop owners said they couldn't guess how long the virus crisis goes on.
Everything in the gold market is topsy-turvy. The price fluctuates during the crisis. Gold price decreased by 10,000 to 20,000 just within a day. The global gold price is also the same magnitude, and the US dollar price as well. The gold and jewelry shop lost level charge and rent for shop as no one bought gold items. But gold block traders saw a big loss. For example, 1 tickel of gold is a gap of 10,000 jas and 10 tickel of gold is 100,000 jas. In comparison with the gold price of the previous year, the price now remains unchanged very much. But this year the gold price frequently changed in the gold market. Now is the time for all of us to be more careful.
There were some examples that gold prices returned to be stable within a week or 10 days in spite of rapid fluctuation. The rapid fluctuation occurred during this year was expected to become stable within a short time, but now it is not easy to guess because of the virus crisis. The global gold price declines day after day. The price was $1,725 per ounce on 27 April. The gold entrepreneurs predicted that the gold price would go on decreasing, although the market price was opened with $1,713 on April 28. The price of academic gold in Myanmar local market stood at 1.1735 million jas per tickel in the middle of March, but 1.160 million jas at the end of March, and now 1.167 million jas. Dr. Myamo, buyer of gold ornaments from Yangon, said,
I used to buy gold when its price declines. All my family members usually buy gold necklaces, gold bracelet, and gold ring. We focus on service, good dealings, and patience when we buy gold from the gold shop. Now is the best time for making gold ornaments. We can't lose in terms of price rate. Gold quality and satisfaction are of importance. We can sell the gold back to the shop and then buy the next one. In this way, we can't lose much, and so it is okay for the buyer.
Well, let's move on to the last report before we go to international news. Fish paste and dried fish industries mainly concentrate in Mon and Rakhine states, Tendai, Ayeyarwady, Bago and Yangon regions in Myanmar, where they are being measured and distributed. Fish paste and dried fish are the essential foodstuffs in Myanmar, and they are mainly distributed to all parts of the country through Bayanang Brokerage Center in Yangon region. Minton and Yenai will tell us more.
Fish paste and dry fish industries mainly concentrate in Mon and Rakhine states, Tendai, Ayeyarwady, Bago and Yangon regions in Myanmar, where are being measured and distributed. Fish paste and dry fish are the essential foodstuffs in Myanmar. The fish paste and dry fish manufactured in the whole Myanmar. The fish paste and dry fish is mainly being distributed to all parts of the country through Bayanang Brokerage Center in Yangon region. The sale of the fish paste and dry fish has been brisk around Thingyan occasion, full of almsgiving event, and the prices are hiking as well. But now there has been a decrease in the prices of the fish paste and dry fish. It was led by Myanmar Fishery Federation. Utun Se, Secretary of Myanmar Fish Paste, Dry Fish, Fish Sauce Entrepreneurs Association said,
The prices of fish paste and dry fish do not go up and fish exists in large amounts. 3-month fishing is closed this May, June, July and August. After that, the fish is still plentiful and raw salt is abundant as well. For this reason, dry fish price does not hike.
စားကုန်ကြံလည်းပေါ်ပေါ်ပြပြရှိတဲ့အတွက်ကြောင့်ဒီဟာကကျွန်တော်တို့ငါချောက်ဈေးမတက်ဘူးဆိုတာမဟုတ်ဘူး
Also Wenai, owner of Ayeyarwady Brokerage, Bayanang Brokerage Center said,
ငါချောက်တင်တဲ့ငါချောက်သမားတွေကအဝယ်ထိုင်းသွားတယ်ကျွန်တော်တို့စီကဝယ်ဆိုတာတရုတ်ပြည်
The purchase of dried fish exporters has become less. We have the buyers from China and Bangladesh. We have also the markets of China, Bangladesh and Malaysia. They are main purchasers. Now the foreign currency is going down and the price is decreasing as well.
ငွေဈေးကျအတွက်ဈေးကျဝင်ဈေးရောလည်းကျအောင်အဲ့လိုရှိတယ်
The price decreases by 20%. The price of ARC is just 80,000 per fish. Now the price has gone down to just 55,000. The price of ARC quite has gone down. The price of Chinese currency also declines and fish trade runs slow. This year, we have more effects when compared to the previous year. Fish is not found much in Chapo, but quite much in Mon State. The fish from Dawei goes to Bangladesh, but now Bangladesh can't buy the fish from Myanmar because of the decrease in US dollar. The price of per fish decreases by just 1,000 to just 1,500.
The border trade is unable to run on a regular basis. The cold storages in Yangon are packed with fish. Now there are difficulties in freezing the fish that is further delivered. Therefore, raw fish will be likely to be plentiful and the prices will be likely to fall as well. Manunwete, dry fish retailer, Thingyan Market in Yangon said.
The market is in a steady situation. The retail of dried fish is okay for me. If it is compared to the previous year, the price this year decreases by 1,000 to 2,000 jas. This year, sale amount is a little bigger. Much dried fish had to be sold before and after Thingyan, which is Myanmar's traditional water festival, last year.
Even though buying fish paste and dry fish in large amount is likely to decrease after Thingyan, there will be an increased buying retail as fish paste and dry fish are Myanmar's basic foodstuff.
And that's all we have for today's reports. Let's check on some international news now. Japan's Prime Minister on Monday extended a nationwide state of emergency over the coronavirus pandemic until the end of May, after government officials warned it was too soon to ease restrictions. Prime Minister Shinzo Abe declared a month-long state of emergency that initially covered Tokyo and 6 other regions on April 7th, later expanding it to cover the entire country. It had been due to expire on Wednesday, but the country's Minister for the Virus Response, Yasutoshi Nishimura, said earlier that new infections were still growing. Japan's state of emergency is significantly less restrictive than measures seen in parts of Europe and the United States. It allows governors to urge people to stay at home and call on businesses to stay shut. But officials can't compel citizens to comply, and there are no punishments for those who fail to do so. U.S. Secretary of State Mike Pompeo says the coronavirus originated in a research laboratory in Wuhan. That's despite the fact that America's intelligence agencies say that they haven't reached a conclusion on the issue. Scientists also argue that virus didn't come from a lab. Let's just take a look at the video.
While scientists work to find a vaccine and cure, some politicians have a quite different focus. U.S. Secretary of State Mike Pompeo on Sunday stepped up the country's ongoing blame game.
I can tell you that there is a significant amount of evidence that this came from that laboratory in Wuhan.
This echoed U.S. President Donald Trump's claim on the origin of the virus.
Anything at this point that gives you a high degree of...
An allegation on which the president was pressed about whether he had evidence.
Was the origin of this virus? Yes, I have. Yes, I have. And I think that
but Trump gave no further details. And the claim from him and Pompeo finds no backing from U.S. intelligence reports. The Office of the Director of National Intelligence, which has been providing support to U.S. policymakers on the pandemic, says it concurs with the consensus that COVID-19 was neither man-made nor genetically modified. The New York Times has highlighted the fact that Pompeo's words are facing spy agencies' uncertainty, and the Chinese Foreign Ministry has already issued its response to the claim.
So far, scientists from the WHO in various countries, including the US, widely believe that no evidence suggests the virus came from a lab.
And scientists have also contradicted Pompeo's claim. Epidemiologist Jonna Marzet has worked with and trained scientists at the Wuhan Institute of Virology. She says there are multiple reasons for believing the coronavirus outbreak wasn't the result of an accident at the lab. First, samples from the lab did not match COVID-19. Also, a cross-species outbreak of that kind would be a rare occurrence. And finally, the lab has very stringent safety protocols. Yuan Zhiming, a senior researcher with Wuhan Institute of Virology, also says it's impossible that the virus is leaked from the institute.
We have strict management system and codes of conduct for scientific research, so we are confident in this.
As the origin of the virus is becoming more politicized, many are calling on countries to join efforts to handle the global pandemic.
It's not helpful and it's not true to blame a country in this way. What we should be doing instead is dispassionately working as partners with Chinese authorities to understand the epidemic and do all we can to make sure that an epidemic doesn't happen again.
In other news, Ghana's dancing pallbearers are having their 15 minutes of fame thanks to the COVID-19 pandemic. The men in black suits are known for their high-octane performances while carrying coffins, giving funerals upbeat vibes, and amid COVID-19 pandemic, they are unknowingly spreading precautionary messages about keeping safe. Internet users and even authorities have been using the dancing pallbearers to spread awareness about social distancing and the fatal consequences of not staying vigilant amid the pandemic. They're churning out memes, stitching together clips, and communicating public service messages featuring these men. The message is simple and perhaps was best summarized by a billboard that popped up in Brazil showing the man in black with the line, "Stay at home or dance with us." The World Health Organization said on Monday that Washington had provided no evidence to support speculative claims by the US president that the new coronavirus originated in Chinese lab. WHO Emergency Director Dr. Michael Ryan told a virtual briefing, and I quote, "We have not received any data or specific evidence from the United States government relating to the purported origin of the virus. So from our perspective, this remains speculative." Scientists believe the killer virus jumped from animals to humans, emerging in China late last year, possibly from a market in Wuhan selling exotic animals for meat.
On your first question, we have not received any data or specific evidence from the US government relating to the purported origin of the virus. So from our perspective, this remains speculative, but any evidence-based organisation, we would be very willing to receive any information that purports to the origin of the virus, because, as Maria said, the origin of the virus is a very important piece of public health information for future control. So if that data and evidence is available, then it will be for the United States government to decide whether and when it can be shared. But it's difficult for WHO to operate in an information vacuum in that specific regard. So we focus on what we know, we focus on the evidence we have, and the evidence we have from the sequencing and from all that we have been advised is the virus itself is of natural origin, and we need to understand more about that natural origin, and particularly about intermediate hosts. This issue was one of the recommendations of the Emergency Committee on 30th of January. It was subsequently repeated in the advice the other day. The Director General, when he visited China when I was there with him, raised the issue at the highest level. Not as a specific issue, but we've been saying this since the beginning. We have to control this outbreak, and this is the most important thing we have to do. But we have to also understand the origin so that we can put in place the right public health and animal-human interface policies that will prevent this happening again.
Well, that's all we have for now. Thanks for joining me on Myanmar Today. I'm Henry Zin. Wherever you are, please stay home, stay safe, help yourselves to help the world. I'll see you again. Goodbye.